Welcome to the Nexus International University Academic Series. Today, we study a subject that the whole world has come to understand in the most dramatic way: public health, and the emerging threats that endanger us all. By the end of this lesson, you will understand how diseases spread, why new dangers keep arising, and how societies can prepare to protect millions of lives. Let us begin with a memory still fresh in our minds. Not long ago, a single new virus brought the entire world to a standstill. Borders closed. Cities fell silent. Economies shook. And millions of lives were lost. It was a powerful reminder of an ancient truth. Throughout history, invisible threats have shaped the fate of nations as profoundly as any war. And in our connected world, they can now travel faster than ever before. So let us define our subject. Public health is the science and art of protecting and improving the health of whole populations, not one patient at a time, but entire communities and nations together. This is the key difference you must grasp. A doctor treats the individual who is sick. Public health works to stop people from becoming sick in the first place. Its focus is prevention, on a vast scale. Now let us turn to the central theme: emerging public health threats. An emerging threat is a danger to health that is new, or newly increasing, or appearing in places it never reached before. Let us examine the main kinds. The first and most familiar is the emerging infectious disease. These are illnesses caused by new germs, or by old germs spreading in new ways. Many begin in animals and then jump to humans, what scientists call a zoonotic spillover. This is why so many outbreaks begin at the meeting point of people, animals, and the environment. As human activity pushes deeper into nature, the risk of new diseases crossing over to us rises. Understanding this link is essential. A second major threat is one of the most serious, yet least visible: antimicrobial resistance. This is when the medicines we rely on, especially antibiotics, slowly stop working because germs evolved to defeat them. Every time these medicines are misused or overused, resistance grows. The danger is profound. Infections we once cured easily could one day become untreatable again. This is sometimes called the silent pandemic, and fighting it is one of the great tasks of our time. There are further threats we must recognize. The health effects of climate change, new disease patterns, heat, floods, and food insecurity. And non-communicable diseases, heart disease, diabetes, and cancer, rising rapidly across the developing world. So how does the world defend itself against these dangers? This is where we meet the powerful discipline of epidemiology, the study of how disease spreads through populations. Epidemiologists are the detectives of public health. When an outbreak strikes, they ask the vital questions. Who is affected? Where, when? And how is it spreading? By answering these, they trace the source, predict its path, and find the way to stop it. This detective work feeds into the first line of defense: surveillance. Surveillance is the constant, watchful monitoring of health data, scanning for unusual patterns. It is the early warning system of a nation, designed to catch an outbreak before it explodes. When a threat is detected, we move to a clear sequence of response. Let us learn its key stages. First, preparedness: the plans, supplies, and trained people made ready before any crisis strikes. Those who prepare in calm survive the storm. Next, detection and reporting: spotting the threat early and sounding the alarm quickly. Speed in these first hours and days can save countless lives. Then containment: acting to stop the spread. This may involve testing, tracing contacts, isolating cases, and the timeless tools of hygiene and public awareness. And finally, mitigation and recovery: reducing harm through treatment and vaccines where they exist, caring for the affected, and helping communities rebuild and learn for next time. The cycle then strengthens our preparedness for the future. Now, a crucial lesson that the modern world has taught us. No nation can face these threats alone. A disease anywhere is a potential threat everywhere. Global cooperation, sharing data, resources and knowledge across borders, is not charity. It is collective self-defense. And here we must give attention to something easily forgotten: the systems behind the response. Strong health supply chains. Reliable stocks of medicines, tests and equipment, ready and well managed. When these systems fail, even the best plans collapse. Good logistics save lives. Now, why does this matter so deeply for Africa? Our continent faces a double burden, battling long-standing diseases while new threats continue to emerge. Yet Africa has also shown remarkable strength, resilience and innovation in responding to health emergencies. To build on that strength, we need skilled people. Experts who can run surveillance systems, investigate outbreaks, manage health logistics, shape sound policy, and lead communities through crisis. Preparedness is built by people, long before disaster arrives. And this is why these careers are so vital. Epidemiologist, public health specialist, disease surveillance officer, health emergency manager, policy advisor. These are meaningful, respected and increasingly essential roles, needed in every country on Earth. So as we close, hold on to the essentials. Public health protects whole populations. New threats keep emerging, from new viruses to drug resistance. Epidemiology tracks them, surveillance watches for them, and a prepared response stops them. And in a connected world, our safety is shared. The next pandemic is not a question of if, but when. Whether the world is ready will depend on the people who choose, today, to learn how to protect it. That choice could be yours. At Nexus International University, Uganda, you can prepare to meet that challenge. Study public health and emerging threats through our hybrid learning and teaching model, online and on campus, built for the way you live and learn. Learn from anywhere, connect when it matters, and move forward without putting your ambitions on hold. Whatever your starting point, there is a pathway built for you. Enroll in a micro-credential to build job-ready skills fast. A bachelor's for your complete foundation. A postgraduate diploma to deepen your expertise. Or a master's to reach the highest level. One program to suit every stage of your journey. Expand your horizons at Nexus International University, Uganda. Enroll now. Visit www.niu.ac.ug today, and take the first step towards the future you deserve. Nexus International University. Boundless by design. Learn. Explore. Excel.